My name is Đurđica Kesak Ursic. I'm primarius, medical doctor, specialist for physical therapy and rehabilitation, and my work is about motor skills improvement evaluation of cerebral palsy child with lower limb spasticity by application of variable abduction hip orthosis. I come from Croatia, small country on Adriatic Sea. We are well known for fine food, fine wine, and of course for football players, Luka Modric and company. We are basically football players nursery, but we also have a long tradition in manufacturing orthopedic devices because we had a war in this region, and as we all know, after war, there is a huge need for orthopedic devices. I'm employed at the Physical Medicine Institution, which is founded and owned by orthopedic device manufacturing company orthosis. Orthosis has been manufacturing orthopedic device for 80 years, but it's also a representative and distributor for Vaho in Croatia. That puts me in potential conflict of interest, but it also provides advantages because before each prescription of an orthopedic device, I can perform a prior functionality check and choose the best solution for my patient. Protocol of this study was made in accordance with the principles of the Helsinki Declaration, and the children during the examination were always present mothers that signed informed consent. Variable abduction hip orthosis or VAHO is in use for over 30 years. It is dynamic standing, walking, and sitting hip orthosis or SWOSH. VAHO is a semi-finished orthosis, and according to the needs of users, it has to be adopted by a certified orthotist. It is a combination of textile, plastic, and metal parts that form the pelvic band, two uprights, and thigh cuffs. And it has 21 orthotics angles and joints, and they are not equal to the anatomical. VAHO limits adduction and allows abduction and hip flexion. Indication is spastic palsy in lower limbs for children of any etiology classified by gross motor function classification system from level 2 to level 5. Contraindications are dislocated hips, fixed hip flexion contracture under 20 degrees, too strong or too short muscle adductors, excessive tibial torsion, and patient size. They should be under 60 kilos. And in welding pump location could be problem, but it is possible to solve by moving pelvic band. Prior to prescribing, it is necessary to check the functionality of VAHO on examined child. Manufacturer says that we can expect by ambulatory and semi-ambulatory children improvement. VAHO significantly improves gait, reduces scissoring gait, improves stability of the trunk during walking and sitting, and enables hands-free sitting. Also reduces the risk of hip displacement. By non-ambulatory children, VAHO improves stability while sitting, frees the hands for the participation in the activities of daily life, what is very important when child goes to school, reduces the risk of the hip displacement. However, its application does not enable non-ambulatory children to walk. That's some of our children, some of our applying. We had 10 participants, 6 boys and 4 girls aged from 4 to 12. 9 of them suffered on spastic tetraparesis and 1 of them of spastic paraparesis. You can see less scissoring gait. Some of our children suffer also on mental retardation, and by all our participants, we had improvement immediately after application. Immediately is considered time within 2 hours because some children need some time to adapt on orthosis and need some time because they're afraid of new circumstances. If there is some improvement within these 2 hours after applying VAHO, it is indicated to use VAHO further. if there are no motor skills improvement within the first 2 hours of using VAHO, it is not expected to occur later and application is not indicated. In a child with noticeable motor skills improvement within that time, application of VAHO is indicated, and in the upcoming months, it is possible to further improve motor skills. We made this study because we wanted to evaluate efficiency of orthotic fitting according manufacturer recommendations. We made clinical examination and filling up questionnaire to evaluate motor skills using VAHO, and this questionnaire is a part of instruction for VAHO application, and after that we analyzed obtained data. In 10 children, we observed parameters improvement of child sitting, posture, walking, scissoring gait, and walking distance in meters without orthosis after VAHO application and after 6 months of usage. Immediately after the application of VAHO, all our study participants had improvement. The manufacturer's recommendation is to use VAHO for at least 6 hours a day, and our participants have used it daily from 2 to 6 hours and an average of 4 hours. They were according gross motor functionality classification system grade 2-1, grade 3-5, grade 4-4. We made statistical analysis by Wilcoxon test of matched pairs, and immediately after the application of VAHO, all children had improvement in posture while sitting, reduced scissoring gait, and increase of walking distance in meters, and that was statistically very significant differences. In all children, there was an improvement of independent standing and walking, and that was statistically moderately significant differences. We wanted to compare these parameters after 6 months of using VAHO, and we made the same process. We made clinical examination and filling up questionnaire by 8 subjects because 2 boys gave up. And we compare the parameters after 6 months of usage, and it was still present the same improvement compared with the status without orthosis, while in the walking distance in meters after 6 months there has been a further increase, statistically moderately significant differences. We published our work in indexed journal Pediatria Croatica, and we asked parents of 8 children about their experience about orthosis. All of 8 parents rated orthosis after 6 months of use with average grade, almost great, and all of them decided positive regarding application of VAHO brace again after child outgrows it. Their experience were the use of orthosis is simpler in smaller and slimmer children. Orthosis is very efficient in improvement of sitting stability. It is more uncomfortable for children to use VAHO when it is hot during summer, and we have in Croatia hot summer, for example, now is 46 degrees. After comorbidity complication leading to deterioration of locomotor status, for example, epileptic status, it may be necessary to readapt the child to orthosis usage. On the photo, we see one of our boy with VAHO and the rotation straps, and VAHO can be combined with other orthopedic devices, for example, orthopedic shoes or ankle foot orthosis. And clinician's opinion at the end is that VAHO is an excellent product for carefully selected users. You can see in front and back of orthosis all these angles and joints, and at the end I can say the manufacturer was right.